Hello, and my name is Angelo Bulanhagi, and I will be talking about meningitis.
Here's a case presentation. A 17-year-old girl presents that she is experiencing frequent headaches with a nauseating feeling, frequent stiff neck, and occasional fevers. The physician begins to ask her questions on her health lifestyle and any recent activities that she has done the past few weeks. She mentions that she loves to go out with her friends to large conventions and concerts. He literally says the venues are so packed to the point that we are shoulders to shoulders with everybody. He also notes that these recurring symptoms started happening around 3 weeks ago. Etiology of meningitis. Now, meningitis is essentially the inflammation of the meninges of the brain and spinal cord. Now, there are different types of meningitis, but the most common one, as highlighted, is viral meningitis, caused via viral infections like influenza, the mumps virus, and measles. Now, the other one that is more serious but not as prevalent is bacterial meningitis. And this is caused by bacterial infections like E. coli, Listeria, or monocytogenes, and other ones. Now, there are the least common ones, which are pretty rare, which is fungal meningitis caused by fungal infections like blastomyces, cryptococcus, and other ones. And these usually tend to occur in people that usually live and work with large exposure to soil, decaying wood, and even animal droppings. And also premature babies are at risk. And this is usually due to breathing in the toxic fungal spores and those getting into your system. Now there is also another rare form of meningitis, which is caused via parasite. And these parasites are usually Cantonesis or B. procinesis and other ones. And this is usually seen in people that eat contaminated produce or undercooked food like fish and poultry. Now this last type is really rare, and it's called amoebic meningitis, caused via amoeba, specifically the Naegleria fowleri. And this tends to occur in people that usually swim in warm bodies of fresh water or that tend to swim in poorly maintained swimming pools and hot springs. And people get infected when swimming because the amoeba enters via the nose. Brief history. Now, as you may know, mening associates with the meninges, while itis means inflammation. And putting those two together gives us meningitis, which is the inflammation of the meninges, specifically the brain and spinal cord. Now, some significant dates. The first one is 1805, and this was when the first ever recorded meningitis outbreak happened. And this occurred in Geneva, Switzerland, and recorded by Gaspard Weissix and Andre Mathy. Now the second date is 1887, and this was where actual evidence proving that a bacterial infection could cause meningitis. And this was discovered by an Austrian bacteriologist named Anton Vaxgebaum. Now 1987 is pretty infamous because this was when a famous outbreak occurred in Saudi Arabia during the Hajj pilgrimage. And then a few days after this pilgrimage, over 2,000 cases were confirmed in Saudi Arabia alone. Then, later on, those outbreaks of meningitis started to occur in different countries. Think about it as COVID-19 in perspective. Now, the rates of meningitis started to decrease, especially in the US. This is a pretty rare. Now, this is due to the likely progress of people having their vaccinations done or immunizations. Risk factors. Now, there's really no evidence proving that one gender is more prone than the other gender. So, this is where females and males are both equally effective. Now, meningitis, although anybody can get it, this is where the extremes of age tend to be more prone to it and suffer deadlier or worse repercussions. And these are the people 60 and over or the people 5 and under. Now, another risk factor are those with weakened immune systems. And what I mean by that are people with immune systems that are those that just had chemotherapy, which is a cancer treatment, HIV infection, which is an autoimmune disease, rheumatoid arthritis, which is a chronic disease, and even those with recent bone marrow or organ transplants. Now, these are the types of people that have that type of immune system that won't be able to fight off infections, either it being bacterial or viral. And now another risk factor are those people exposed to large groups or people that travel often to foreign places. Now this is where you can catch something. Pathophysiology of meningitis. Now meningitis is hematogenous, meaning that it originates or is carried in by the blood. Now, first step is bacterial invasion in the bloodstream crosses that brain-blood barrier. And now bacteria could enter via the nose, especially through your nasal and all of that. Second, release of cytokines, which induces an inflammatory response. And that's where you get that hot feeling of fever. Now, the third, which is pretty the serious one, which is where subarachnoid, arachnoid, or the pia mater inflames due to that infection. And then that inflammation is essentially caused by like those cytokine release, and that induces neck stiffness. And now I highlighted especially fever and neck stiffness because these are referring to our patient's certain symptoms. Now here's pathophysiology continued. Now here on the left, we have a normal anatomy of the brain and spinal cord. Now as you can see, it's normal. Nothing's really swelling or inflamed, especially in the meninges and that spinal cord. But when you look at a brain and spinal cord with meningitis, in this case, bacterial meningitis, you could see that the brain's meninges are pretty swelled up. And look at the space between the skull and the brain, it's basically touching. Now, also the spinal cord is pretty inflamed too, as you compare it to the left one. Symptoms of our patient. Now here's where our 17-year-old patient presents that she's having these frequent headaches with a nauseating feeling, frequent stiff neck, and occasional fevers. She also notes that these recurring symptoms started happening around 3 weeks ago, which is pretty recent. Now she literally says that the venues are packed to the point where we are shoulders to shoulders with everybody. Now this gives the possibility that she probably caught it via her nasal passageway, especially when you're hanging out with a lot of random people. That gives chance for a bacterial infection to come in and compromise your system. This one is lumbar puncture, and this allows for the collection of cerebral spinal fluid, or called CSF. Now the results of this test yields if you have an elevated white blood cell count, elevated protein, and low glucose, that's a pretty good sign that you might be having bacterial meningitis. Now, a second form of diagnosis is a CT scan or MRI. And as you may know, these tools are used for imaging, especially detailed images, to see if there's actually inflammation or swelling occurring in your head. Now, this last test is the blood sample test. And this is when cultured, you will get to see if any bacteria or stuff in that sample grows. Now, these blood sample results from this blood sample test results in a CBC, which is a complete blood count. And typically, meningitis tends to yield results that give you an increased or elevated white blood cell count along with increased protein. Now, from what I found, the best method for identifying meningitis is via lumbar puncture. And that's essentially, as we talked earlier, when the cerebral spinal fluid is collected. Now, the results that tend to yield after this test usually comes with an elevated white blood cell count, increased protein, and low glucose level. And the reason for that white blood cell count is via trying to fight that infection. Now we have treatment, and this really depends on what type of meningitis you have. Now, for the first one, the one that our patient has, is administered antibiotics. And now for the second one, which is viral meningitis, this is where you can have antiviral medicine, or sometimes if it's not even that serious, because some of them aren't that serious, you just have resting time and the body will do it itself. Now for fungal meningitis, you have antifungal medications, but for these last two, which is parasitic and amoebic, for parasitic, there is no particular treatment used to combat these parasites that cause that meningitis. And this is where you can take some pain medications to ease that pain and irritation, but there is no particular treatment to treat parasitic meningitis. Now, amoebic meningitis, which is pretty scary, not going to lie. Now, this is where, although there are a number of drugs that are effective to this Naegleria fowleri amoeba, which is that freshwater amoeba that we were talking about when you swim or go in that body of water. The scary thing is, there is no proof of them working due to almost all the infections happening, of them being fatal. And this is amoebic meningitis. Now, this is where we have administered antibiotics for bacterial meningitis. Now, you can either take these orally or through IV or intravenous. Now, this depends on your situation. Oral medication is usually used for subacute meningitis, which happens over a long period of time. Now, IV or intravenous is used for acute meningitis, which happens over a short period of time. And this could be coincided with our patient's symptoms from earlier, where she says that she started experiencing these symptoms recurring for 3 weeks, which is a short amount of time. Now we have some common drugs, which are Suprex, Mexapine, Teflaro, and other ones, and this is in the cephalosporin class of antibiotics. Now we also have penicillin class antibiotics and aminoglycoside class antibiotics. Now this type of class of antibiotics that we will be talking about is the cephalosporin class antibiotics. And this is pretty interesting too, because there are different generations of antibiotics. Now, we can start with the second generation, which was effective against the H. influenzae. And don't get this confused, this doesn't cause influenza. Now, the third generation, which was the one I highlighted, was essentially a better version of the second generation. And this was against and effective on E. coli, H. influenzae, and Klebsiella, and other ones too. Now we also have the fourth gen and the fifth gen. And now, as we can see, this is pretty progressive, meaning as each gen occurs, most of the time, it will be effective against other forms of bacteria. Now, these are my references. And if anybody has any questions,